Now, the next, I suppose, topic I'm going to discuss is a rather difficult one to fully explain. The bladder pain syndrome, interstitial cystitis, is a condition that has been around a long time. We're really only getting to know a little bit more about it, and certainly only at the tip of trying to work out how to treat it. It's a very debilitating disease, and it presents with a lot of symptoms, but predominantly there's a pelvic pain issue. It's associated with pain with urgency, frequency, nocturia, and usually going to the toilet quite often quite small volumes. And this is very much a diagnosis where we've ruled out a lot of other things. We've ruled out infections, we've ruled out any other gynecological problems, and we're left with this constellation of syndromes. There's no diagnosis for it. There's no one test that will definitely confirm that you have this, but it's a very common condition. Overall, almost 40% of women have pelvic pain, so that's quite a considerable amount of our population. And up to 12% of those may actually have a type of bladder pain syndrome or interstitial cystitis. It's commonly associated with irritable bowel syndrome as well. And for it to be diagnosed, it can't just come and go this week. It has to be present for at least 6 weeks. And in this particular syndrome, the pain typically worsens as the bladder fills and is usually relieved after it empties. It may indeed in women fluctuate with the menstrual cycle, and like overactive bladder, this is also present in men. And again, a bit like overactive bladder, the symptoms can vary quite a bit, and you can have good time and bad time. Symptoms can be very different between women and men, and also for the same person at the month, and during the month can have different symptoms as well. One of the biggest problems with it, it very seriously affects the quality of life for patients, and it's been described as patients would find their quality of life as worse with painful bladder syndrome than actually on renal dialysis. It curtails job work, leisure activities, family activities. It can cause quite distressing pain during intercourse. It can cause a type of fatigue syndrome, and it certainly leads to unnecessary operations trying to find a cause for pain, and a significant amount of money can be spent on trying to find a cure for it and manage it. Because we don't really know what causes it, it can be a little bit hard to diagnose, and it's often a condition that we find by outruling other conditions. So we need to outrule urinary tract infections, overactive bladder, other gynecological problems, stones in the kidneys or in the bladder, and also we need to outrule malignancies, so any types of tumours that may occur. The management initially, there's a very good website, which is the Interstitial Cystitis website, that looks at diet, and this gives a list of good foods and bad foods. No more than caffeinated drinks can irritate the bladder. There's a number of drinks, foods that can irritate your bladder, and often avoiding these or switching to different types of foods can help your symptoms. And from a painful bladder syndrome point of view, it's all about managing the symptoms. We can't take it away completely. Physiotherapy is very useful. There's a lot of muscle tension, spasms caused by this. A lot of it is helped by stress and life management, and also by pain relief medication. There's a number of drugs here that act both on the brain to help decrease the perception of pain and directly on the bladder. These are taken, some of them are tablets, and then there's a number of therapies that can be given into the bladder directly, which act on the bladder surface itself. One of the common ones we use in Ireland here is hyaluron or cystostat. And then you're really moving on to surgery, and the surgery is can be quite invasive. There are some people who have ulcers that need to be resected from the bladder, filling up the bladder and making it kind of over distend a little bit, and then Botox can be useful to paralyze the bladder and get rid of some of the frequency, and neurostimulation and major surgery will be actually taking out the bladder itself. So it's quite end of line stuff and be for very, 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 very badly suffering women. It really is a chronic and a severe disease, but it's just important to emphasise that it can significantly influence daily life. It has quite an impact on your activities, and so that we'll continue to have a lot of research into it, and hopefully we'll have some more treatment options in the future.